Welcome to the lecture on pediatric pharmacology. This is the first of 5 lectures. Pharmacology in children is going to differ from what you're used to with adults. We must administer medications safely, accurately, and in a timely manner, similar to adults. But with children, extra caution is needed. You need to have a working knowledge of drug pharmacology. You need to know how they work, why they work, what to expect. Is the drug really indicated? You're going to find that your dosage calculation and methods of administration are going to differ from that of adults. It's very important that you always know the potential interactions when someone is on numerous medications. For pediatrics, what are the contraindications regarding the fact that they are a child and not an adult? And as always, you must know what the common side effects are. Now, differing from adults, you have to have a lot of skill and creativity when you are going to administer medication to a child. They're not just going to sit there and say, okay, put it in a little cup and down the hatch it goes. Your job is also to educate the parents as well as the patient when they're old enough and can understand about the medications that are given in the inpatient, outpatient, and home setting. As always, the nurse must follow the 6 rights of medication administration, and I'm not going to review those. These should be well ingrained into your practice. We must calculate and verify that the dosage that has been ordered is safe to administer to this child. In addition, you must assess your patient. Always question, is this the right drug to treat the condition that this patient is in for? Well, gee, no, they're in for pneumonia and I'm giving them Synthroid. What did I miss in the history that I'm giving this drug? Don't just be an automaton going to the bedside just because the doctor or the nurse practitioner ordered it and give the medication. Know who your patient is. In addition, you need to assess how well your patient is responding to the medication. As always, you must prepare and administer the medication correctly. When giving IV medications, you need to assess and reassess much more quickly than you would when you're giving something topical, otic, oral, etc. Something that you've probably found is quite different when administering medications to children is that we dose them different. You have an entire math module that when you first looked at it was probably scary, but I know that you can all do it because you know how to add, subtract, multiply, and divide. That's all that it is. We dose children on a milligram per kilogram per day basis. Sometimes they have it as a milligram per kilogram per dose. It's the same thing. When we're giving chemotherapy agents, these medications are dosed based on their body surface area. When we administer IV fluids to a child, we calculate what their IV fluid maintenance requirements are. We first do it as a 24-hour total, and then we divide the 24 so that we can get the hourly requirement. So if you calculate this early in the morning, which you should do every single day, and you find that a child should be getting only 15 mLs per hour, and you go in and you look at the pump and it says 30 mLs per hour and they've been on it all night, you need to assess that child because we're giving them double what the requirements are and we're going to send them into congestive heart failure very quickly. On the other hand, when a child is dehydrated, we are going to give them their maintenance requirements plus whatever the percentage of dehydration they are. So if they're 10% dehydrated, in addition to their maintenance requirement, we're going to add 10% more mLs per hour until the child starts responding. And that's why it's so important for you to reassess, because a child can turn around within a couple of hours after IV administration of fluids and they get much better. Then we need to reduce them back down to their maintenance requirements. When we give a fluid bolus, we usually use normal saline or lactated ringers. This is dosed different. It's 20 milliliters per kilogram and it's infused over 15 to 30 minutes. This ends part 1 of pediatric pharmacology.